This video is to help guide you on the exercise phases to follow status post a lumbar surgery. Follow the instructions per your physical therapist for guidance on which phase and when to progress phases of exercises. Phase 1 exercises are designed to re-educate your body on core control and starting gentle mobility. You're able to perform these exercises 3 to 5 times a day, 5 to 7 days a week. First, start with abdominal bracing. Lay on your back with your knees bent up. Take a deep breath in, letting the rib cage and tummy expand, and then breathe out fully, feeling your rib cage drop and your tummy under your belly button draw in. Maintain that contraction as then you breathe normally through your diaphragm, letting your rib cage expand outward, not letting the chest rise too much, and maintaining that abdominal contraction. Hold for 10 seconds to 30 seconds. If you feel that your back moves or you're unable to hold the contraction, work within the time frame that you can do a proper contraction for the abdominal bracing. This is important to be able to do to further progress in your exercises. Again, take a deep breath in, allowing everything to expand, and then breathe out, drawing in, rib cage down, and tummy sucks in. Hold for 10 to 30 seconds, breathing normally while you hold the contraction. You don't want to be holding your breath while holding this abdominal brace contraction. You will repeat this 3 to 5 times, multiple times per day. This exercise should not cause any pain or discomfort. Next is learning how to do a pelvic tilt. So what you're going to do is be rocking your pelvis forward and backward, or kind of arching your back off the floor and then flattening your back into the floor just by moving your pelvis. The first phase of this is done with knees bent up and feet flat on the floor. Perform 10 repetitions. If you are having trouble or this is the first time doing this, perform this phase for 3 more sets. It is not a big movement, so you shouldn't be arching through your mid-back or neck. Try to keep the movement in just your pelvis. Again, this should not cause much pain or discomfort. As you become more proficient at the pelvic tilt, you can then progress to the next phase with one leg out straight, one knee bent. Again, rock your pelvis forward and back 10 times for 3 to 5 sets. Per leg out straight with one knee bent. Again, there shouldn't be much pain or discomfort, but you may notice that this does get harder, especially if you are tight in the front of your hips. But this exercise will help retrain your body to move through your pelvis and get length through the front of your hips. As the movement improves and you get more comfortable with performing this exercise, you can progress to the third phase with both legs being out straight. Again, you might notice that movement is even less or a little bit tighter and harder if you are tight through your hips. Again, try to arch and flatten by using your pelvis to tilt forward and backward. Perform 10 repetitions for 3 sets. The last phase is to perform the pelvic tilt in standing. You may begin in standing before you start full laying on your back with legs straight phase, and that's okay. Same movement pattern though as you were doing on the floor by rocking your pelvis forward and then back. Perform 10 repetitions for 3 sets. The next exercise in phase 1 is the bridge. Perform the abdominal contraction you've been practicing. Squeeze your glutes and lift your hips. Then slowly, with control, lower back down. Be sure not to overarch your low back at the top, but maintain that abdominal contraction. If you feel that your hamstrings cramp, make sure that you're not digging your heels into the ground, but pushing evenly through the middle of your foot as you lift. You're going to perform 10 repetitions, and then I will take you through a piriformis stretch. So cross one leg over your other, and instead of pushing out on that knee, you're going to draw that knee into your opposite shoulder. And you should feel the stretch through the outside of that hip. You're going to hold this stretch for about 30 seconds. Don't pull too aggressively, as you don't want to go too deep into pain. After 30 seconds, switch sides. And again, pull on that knee towards the opposite chest for a gentle stretch on the outside of your hip for 30 seconds. After 30 seconds, release and perform another set of bridges. Perform 10 more repetitions, remembering your abdominal bracing contraction and lifting using the glutes and not your low back. Make sure not to hold your breath while performing your repetitions, but breathing normally. After this set, you'll perform another set of the piriformis stretch on each leg. As you're holding the stretch, make sure that you're breathing through your diaphragm, deep, full breaths. Try not to hold your breath as you hold the stretch, but allow your breath to help relax the muscles. Then, after that last stretch, perform a third set of bridges at 10 repetitions. After the 10th repetition, you will perform another set of the piriformis stretch for 30 seconds on each leg. After this last stretch hold, this will conclude your phase 1 exercise routine. Perform 2 to 4 more times today, as long as there's not pain or soreness caused.